This is Dr. Nimish Shelat, Senior Consultant Obstetrician and Gynecologist and European Board Certified Microsurgeon, pioneer of IVF in Gujarat state, and it's a great pleasure to discuss the fallopian tube. Fallopian tubes are the most important and very vital tubes which are attached to the womb, or as we call it, uterus in technical terms. The womb has these two tubes in every woman and in every female who grows up, right from a toddler to the adult and into the menopause. These tubes are functionally one of the most important organs of the body that will propagate the human species. In fact, new babies which are coming, new births which are happening with the natural course of events are because of the fallopian tubes. This is the location in the human body of the female where life begins. So you can understand how important is this organ. Its importance has been very much underestimated. It has been almost forgotten. I would say the word F is for forgotten fallopian tubes. And the reason for talking this today and explaining this to you is to give you the real insight and idea why is this organ so important and why it has gone into the oblivion. And it's the medical science which has to pull it through, and we are there to support and develop the problems with the fallopian tubes which have to be sorted out. The basic problem with these tubes can happen during infection, but before going that, its role in pregnancy must be understood. What it does is that as soon as on the day of 13th or 14th in a menstrual cycle of every woman who is in the reproductive age, there is an egg which is released from the fallopian, from the ovaries, and once these ovaries release these eggs, the fingers of the fallopian tube which are on its terminal end, which service the ovarian surface, pick up these eggs as if a hand picks up the ball. And these eggs are then, which are picked up, or a single egg which is picked up, is then actually sucked into the tube by what is called a chemotactic mechanism. And as the egg moves into the fallopian tube, it is the process wherein the movement is created by small hairline-like cells which are called ciliated cells, and they have hairs which promote and propagate the movement of the egg, which is otherwise immotile. An egg cannot move on its own. And it stays there for quite some time till it meets the sperm during a healthy human intercourse. And when it meets the sperm, which has passed through the vagina, entered the womb through the neck of the womb that we call the cervix, and from the womb through the opening of the fallopian tube, it enters the tube and meets the egg there, which is waiting after ovulation for almost 24, 36, even 48 hours. Once these two gametes, as they are called, they meet, there is what is called fertilization. Egg and sperm meet together and their DNA gets combined, and this is how the first human body, or what we call the zygote, is formed. This zygote then starts getting divided into 2-cell, 4-cell, 8-cell, 16-cell stage, and it is at this stage that within 4 to 5 days, when a blastocyst occurs, this embryo, human embryo, almost migrates back into the womb, and this function is also performed by the fallopian tube. So you can understand how much involuntary work this tube is doing to produce another human being. So as I couldn't explain it in any better way, I'm sure you will understand this, and once you have understood this perfectly, you will be able to then understand why it is so important to restrain and manage the tubes and keep them healthy in every woman's body, particularly in the reproductive age.